So, Cleo, I'm reviewing the chart notes from yesterday evening, and it looks like Mr. Jones was admitted last night with acute onset of weakness and syncope.
Yes.
Is that correct? And you presented his case to me, and I know we did see him together, and I do agree with your physical exam findings here. He is still disoriented to time and has tremor, as well as horizontal nystagmus. What do you think is going on with him?
Well, he has a seizure disorder and he takes carbamazepine, but he has been seizure free for last 2 or 3 years, and he does not have any history of alcohol use or any recent fall. They did a CT scan and an EEG in the emergency room yesterday, so I don't think which was all normal, so I don't think he is posted anything like that.
Then, okay, so what do you think is causing his symptoms?
Well, he did have other labs like the CBC and the BMP, which were all normal. You know, the tox screen was normal.
Okay.
He did have some hyponatremia. His sodium was 132. Maybe his hyponatremia.
So why do you think he is hyponatremic, Cleo?
Well, he's on carbamazepine. That could cause it.
That's right. That's right. Very good. What else do you need to consider, however? You think of a carbamazepine level, maybe?
Yeah.
Okay, well, what was it last?
Well, it was 8.3 last week.
Okay, good. I'm glad you were aware of that. And now, what is it now?
Now, I don't think we checked it now.
Well, okay, so, kind of reviewing things, you did a very nice job with his neuro exam. You were thorough, and you appreciated the subtle level of his nystagmus, which I can see here. You did also check for really bad things like infection, as well as aplastic anemia or electrolyte imbalance. So I really like that you went into that degree of detail in your notes and your assessment. One thing to remember, however, is that when patients are on anti-epileptic drugs that present with any new neurological symptoms, it's important to know what the blood level is of that medication. Some of them have very narrow therapeutic ranges, and you have to remember that principle. Okay? So why don't you go ahead and order a stat level, and I agree with the plan that you've written here to restrict his fluids. We'll both check back on Mr. Jones when we meet up later on after rounds in the afternoon. Is that okay?
That is okay. That sounds really good. So I will order the carbamazepine level, and I think I also need to read more about the differential diagnosis of hyponatremia, maybe.
That sounds like a very reasonable plan, and I'm glad you kind of came up with that on your own. Do that and share what you've read with me when we meet up later this afternoon. Is that okay?
Yes, thank you.